Hello everyone, I am Rose and I'm going to explain about respiratory PNF. Respiratory PNF is a selective technique or the treatment technique used for respiratory care of the patient with unconsciousness or non-alert and ventilated patient. What does respiratory PNF do? It assists respiration by improving respiratory volume. It will also help to increase chest mobility. In ICU patient, it helps to get proper ventilation. It maintains breathing patterns. And right here, I'm going to demonstrate two techniques. The first one is intercostal stretch, and the second one is manual pressure. In intercostal stretch, first of all, if the patient is obese, we are palpating the sternal angle to get the first intercostal space. The sternal angle, the other name is called angle of Lewis. So below the clavicle is the first intercostal space, as I'm palpating here. As you can see, I will prepare my two fingers. This is a technique for intercostal space stretching. I'll prepare my two fingers, and these two fingers I'll place below the rib, and I will start at the forehead. When we have two ribs, suppose the first and the second rib. When I'm doing intercostal stretch, I'll give stretch to the second intercostal space by applying pressure on the third rib. So we are palpating intercostal space between two ribs. As I said, suppose we have a second and third rib, so we are going to stretch the second intercostal space, not the third one. We are applying the downward pressure, and the pressure is applied horizontally, and after applying the pressure horizontally, this intercostal space which is going to stretch is a second, not the third. So same applies to the fourth and fifth ribs. When I'm applying downward pressure to the fifth rib, it means I'm stretching the fourth intercostal space. If I'm applying downward pressure over the sixth and seventh rib, it means I'm stretching the sixth intercostal space. When I'm applying to the 9 and 10 rib, I will stretch the 9 intercostal space. You can see, as I'm doing here, I apply gentle pressure horizontally over the second intercostal space. So this technique is helpful. You ask the patient to take deep inspiration, and while he's doing expiration is where you are going to apply stretch. So you ask patient to do deep breathing, and while he's doing expiration is where you apply your gentle pressure. Another one is manual pressure. In manual pressure, we are going to apply gentle pressure over the thoracic wall. In different parts of the chest, we are going to apply pressure, and we hold for 10 seconds and we remove the hand. Again, we go to another part of the lobe. We apply gentle pressure, we hold for 10 seconds. Again, you will go to another part of the lobes, of the lung lobes, as you can see. So you will apply gentle pressure and the technique will be done. Thank you.